Welcome viewers. I am Dr. JP Das, Director of Mausami Hospital and Principal of National Institute of Medical Science, also a sonologist. Today we shall teach how to do imaging of sonographic imaging of kidney. Actually, first part we have done in the previous video. In this video, we shall do the second part. Let's start. The ureter, here you see in this slide, it is ureter. Okay, this is ureter. Ureter about 25 centimeter long. It is about 25 centimeter long, and more or less 10 centimeter, 10 inches long, and it has three constriction it has. First one, when it leaves the kidney pelvis here, and second, when it pierces the urinary bladder, and one in the when it crosses the pelvic brim. These three, 1, 2, 3. The pelvis, in the pelvis, it is like a funnel. You see, it is like a funnel. And in the hilum of the kidney, and where it receives the major calyx. And one thing you have to remember, that is ureter is extraperitoneal. Sonographically, you cannot see the ureter, but you can see it when it is dilated. Here, see in this picture, it is a dilated ureter, but when it will not be dilated, it is very difficult to see sonographically. For examination of the ureter, the patient should be tilted to the opposite side. Say I want to see the right ureter, then the patient should sleep on his left side. Then we can see the right ureter. The operator first see the kidney, then the hilum, and the area where the dilated pelvis of the ureter should be seen first. Gradually, the probe should go down obliquely and over the lateral side of the abdomen and downwards to the suprapubic area. By this way, you can visualize you can image the ureter properly. In supine position, while examining the urinary bladder, you can see the dilated, small, round, cystic structure posterior and close to the bladder at the lateral aspect outside bladder well. This view, it is actually, see this picture. See this picture. This view is cross section of the ureter by transverse probe folding. Look at this picture. Here is a stone, you can see very nicely. This type, it is very common, vesiculo-ureteric junction calculus. In supine position with distended bladder, the probe should be held obliquely in the line of the ureter with the pressure on the vesiculo-ureteric junction to visualize the calculus. Otherwise, one will miss the normal supine position and transverse scan. You look at this picture. Here is indentation on the renal capsule. here one, here one, producing incomplete compartment. Renal pyramid is regular. You see, it is renal pyramid is regular. Spacing the parenchyma normal thickness. The normal thickness, it is spacing the normal. It is fetal lobulation. It is called fetal lobulation. What you see in this picture? See, a triangular area. Here, a triangular area which is echogenic. It is echogenic within the renal parenchyma due to fat extending. The fat is extending from the renal sinus, to the parenchyma. This is junctional parenchymal defect. What you see in this picture? Here, the invagination of the cortex. This is the cortex. Appearing as a march lesion. It looks like a march lesion, producing the lateral indentation of the renal sinus. This is a pseudomarch, has a echogenicity similar to the renal parenchyma. This is renal parenchyma, and see the echogenicity almost similar. Continuous with the renal costal single and multiple. It may be single or it may be multiple. Generally, it is less than 3 cm and continuous with the renal costal area. In color Doppler, you can see the renal march. The vessels are displaced, and this is called hypertrophied colon of Bartin, and the vessels go through it. Hypertrophied column of Bartin. What you look in this picture, you see this area. Here is increased echogenicity in the renal sinus due to fibrofatty tissue, the presence of fibrofatty tissue. When the tissue increases, the sinus area appears enlarged. It's enlarged. Parenchyma became thin. Here, the parenchyma became thin, or parenchyma may be normal or may be entropic. Thickness of parenchyma generally less than 1 cm. If it is less than 1 cm, we can call it atrophy. What you look in this picture? You see the renal pelvis extend outside the renal sinus. Yeah, it extend outside the renal sinus. It may be appeared dilated renal pelvis. Unlike the hydronephrosis, it is hydronephrosis is, see, there is a little difference. It is not like hydronephrosis and not associated with the dilatation of the renal calyx. Renal calyx is normal, not dilated. It is called extrarenal pelvis. So students, we have come in the end of this video. Today we have seen some slides where we have discussed some part of the renal imaging by ultrasound. I hope you have liked it. If you have liked it, please give a like. If you are new in this channel, please subscribe this thing such that I can bring such informative videos to you. In the next class, we shall show you the third part of the renal kidney imaging by ultrasound. Thank you very much for viewing the class. Hope to see you in the next class. Until then, bye bye.